update. Over the last 24 hours, we have identified 1,307 additional cases of COVID-19 in Alberta. Yesterday, we completed more than 15,800 new tests. Our provincial positivity rate currently sits at about 8.4%, and we now have 16,628 active cases. There are 479 people in hospital, including 97 who have been admitted to the ICU. Sadly, there were 10 more deaths related to COVID-19 reported to Alberta Health in the past 24 hours. I know this is a difficult time to grieve, and my deepest sympathies are with the families and friends of these individuals and everyone else mourning the loss of a loved one from any cause right now. I also want to recognize everyone with a loved one in hospital or an outbreak setting or who's been impacted by COVID-19 in any way. This virus impacts all of us. In schools, there are currently active alerts or outbreaks in 393 schools, about 16% of all schools in Alberta. Currently, these schools have a combined total of 1,453 active cases. This number includes 207 schools with outbreaks, including 92 currently on the watch list. With the calendar flipping to December today, I know many people across the province are starting to plan for the holiday season. For many of us, this upcoming season is about socializing and spending time together. December is when we typically spend time with family, friends, and colleagues. Potluck lunches at work, school performances for kids, gatherings in friends' homes, and big family dinners. It's been a long, hard year, and I know how important these holidays are to Albertans. But in a year that is anything but typical, how we celebrate won't be typical either. We don't yet know exactly what restrictions will be in place during the last week of December. Cabinet will make those decisions later on this month. However, in the past we have seen holiday gatherings lead to increases in cases and outbreaks as one case spreads to many. For example, Thanksgiving gatherings were an accelerator of spread, and the impact is still being felt. The bottom line is that it only takes one person to start an outbreak. The higher the rate of community transmission, the more risky these gatherings can be, and our transmission is higher than ever before. I know it is challenging to make plans as we wait to see what effect the measures announced last week will have and what will come next. Right now, though, I am encouraging Albertans to begin preparing for a much different holiday season and to start thinking of creative ways to celebrate safely. This is not going to be the year for in-person office parties. This is not going to be the year for open houses or large dinners with friends and extended family. If you are making holiday plans, it is best to assume that you will still be limiting contact with anyone outside your household as much as possible, and that any larger get-togethers will likely need to be virtual. This will be the year for getting together remotely or having small outdoor activities where everyone can keep their distance. Celebrating virtually or with members of your own household pose the lowest risk for spread. Although this is hard, there are some silver linings to trying out non-traditional ways of coming together. We have been concerned about the trajectory in our healthcare system impact from COVID-19 for some time. That is, of course, why we have been introducing measures, and the most recent, the stringent measures that went in place last week. With respect to how we're tracking on that curve, again, the work that we've been doing with Alberta Health Services to make sure that the system is prepared should those cases continue to rise is an important part of preparation, but the question of whether we track on that high, medium, or low line, that really is in the hands of all Albertans. If we can all minimize the number of close contacts we have every single day, that is what will bring that curve down. We have not changed our overall visitor guidance for long-term care. However, what I did do several weeks ago was I did send a letter to all continuing care operators across the province asking them to take this opportunity to look at their specific sites visitor plan, and in places like Calgary and Edmonton where we are seeing increased rates of spread, that they take the opportunity to consider whether they may want to limit the number of visitors to just those designated support people for each of their residents at this time. And so again, when we released our updated visitor recommendations in July, what we wanted to do was to allow operators to have conversations with their residents, with family members, with their staff, to be able to utilize information about the wishes of those individuals as well as the context that those sites are located in. And so there was a concern expressed that when I sent that letter, that I wasn't at the same time making sure that the public was aware that this was my recommendation. So that was one of the conversations that we had, was the importance of making sure that we're being consistent and clear, and that the recommendation, although we haven't seen significant spread from visitors into continuing care, that risk does get higher as community transmission increases. So I will repeat something I said, I think, last week with respect to if you have a loved one in continuing care and you are not one of their designated support people, consider whether there's other ways of providing support to that person now, especially if you live in an area where there is increased community transmission.